Salam sejahtera dan salam UiTM di hatiku. I am ELVIANA Tiffany Anak Louis, student semester 4 for the course AGR244 Pest Management. Today I would like to elaborate more on white root disease in rubber. Natural rubber was a critical pillar of Malaysia's export-oriented economy throughout much of the 20th century. Early in that century, rubber overtook tin as Malaya main export earner and was the dominant component in accounting for variations in export growth. And a variation in export growth accounted for much of the volatility in annual economic GDP growth. Thus, this is a fundamental value to the country. Rubber with disease should not be taken lightly. One of the diseases affecting rubber is white root disease. The scientific name is known as Rigidoporus microporus, and the common name is white root disease. Next, I will be explaining the symptom. White root fungus is difficult to identify in its early stages unless the rubber tree base is examined. Second, the green color of the leaves appear to be slightly uneven in comparison to the deep green shade of the undamaged branches. It is common for them to turn yellow. White root disease is a fungal infection that grows on decaying exposed root and stumps, and it can kill trees. Furthermore, white root disease's rapid growth can be accelerated, especially during wet seasons, and the disease can be persist in both leaf and dead hosts. Finally, it spreads quickly and can infect trees in areas with inadequate sanitation and drainage. Its pathogen is capable of surviving in dead trees. The effect of white root disease on yield. White root disease is the second most common rubber disease. However, according to recent poll, Rhignigerus lignosus is the most important species in the main rubber growing region. The pathogen is most prevalent with the first 5 years of plantation existence. Even if the annual incidence is minor, the cumulative losses from the spread to nearby trees might result in enormous void. Losses differ from nation to country and field to field, with moisture levels having a significant impact. The reported incidence ranges from 2% per year in Cameroon, Gabon, and Ivory Coast to 8 to 10% in Sri Lanka, 10 to 15% and 5 to 10% in Indonesia. In Indonesia, there were many occurrences of blocks of 3-year-old plants with a 30% incidence rate. In small holdings, the incidence was 40 to 60%. As a result, such areas would need to be replanted early before the age of 20, as less than 30% of the original stand would remain by then. White root disease was an issue for 43% of smallholders in Malaysia, according to a survey, though the incidence was not indicated. White root diseases economics have been studied. Aside from the loss of yield due to tree death, the cost of treating root infections add to the overall production cost. Current control practices. Control, particularly those aimed at lowering the inoculum level, relies heavily on cultural tradition. The procedures employed to eliminate all trees from the site determine the residual level of inoculum when a rubber patch is to be replanted. In a replanting, full mechanical clearing, uprooting the trees, plugging and raking the area to collect and dispose of the rubber roots results in the least amount of root disease. Smallholder can clear land by removing trees with chainsaws and using arboricides to induce rapid decay, but this technique is too expensive for them. By promoting faster decay of inoculum and generating suppressive conditions for Rhignigerus lignosus, creeping legume coverings help to reduce the prevalence of white root disease. To minimize infection by spores, workers should avoid harming the roots of the plants. Wherever possible, infected trees and their roots should be removed. Alternatively, sick trees should be confined within a trench area, especially in a mature rubber region, to prevent disease and healthy tree roots from coming into touch control practices. To conclude, disease such as white root disease is very important to determine yield quality and productivity. Thus, it should be treated by implementing control practices as mentioned earlier. By being aware of the symptoms and observing changes caused by root disease, infection can be reduced and controlled as well. That is all from me. Thank you.